We're going to show you a few techniques to massage the muscles of mastication.
We're going to start with ear pulling. So take your hands to your ears, probably halfway between the earlobe and the top of the ear, and you'll simply pull straight out laterally. You might notice one side is tighter than the other, and you might notice an angle that you're pulling might be tighter than a different angle. So just spend some time making your ears feel loose in the fascia and the connective tissue while you just pull and breathe. Next, we're going to do a technique called skin rolling. So this is another fascia technique. We're going to skin roll the masseter. So you take your fingers to your bottom jaw and roll your cheek up, kind of towards the, kind of right in front of the ear. And then you start over. You go back to the bottom jaw and you'll roll with your fingers, keeping a pinch of skin the entire time. As you walk that pinch of skin up, you're going right over the TMJ, the temporal mandibular joint, as you skin roll your masseter. And you'll do that on both sides. We will now skin roll the suprahyoid area from kind of midway down the neck, and you're going to pull on the skin in that same way and roll all the way up to your jaw. It's probably going to feel a little tighter when you get to the bottom angle of your jaw, and that's where you want to focus on. So you take your fingers and roll all the way up to the jawline. So we're going to now massage your main biting muscles. You have temporalis above the ear. We'll start with that. So you're going to take your fingertips and either one side at a time or both sides, just rub above your ear, above the temple, and up and around towards the back. So you'll get a pretty large area of your scalp. So if you put a fist right around, yeah, that's about what your temporalis size of the muscle looks like. So all around there, you can rub all around your temples. Anytime you feel something that's stringy or tender, you can just stay right on there until it releases. Next, we're going to friction our masseter muscle, our other big biting muscle. It's basically most of your cheek. We're going to start by going right underneath the cheekbone. Once you feel that bone, you're going to press your pressure upwards. So it's like you're right underneath the bone, pressing right up. And you're going to make tiny little side-to-side friction movements. If you can remember, just go one direction with the friction rather than sawing back and forth. And you can cover a pretty large area. It's called the zygomatic arch, that whole ridge towards basically kind of halfway towards your nose. You can keep going with that under the entire cheekbone. Finally, we're going to friction the bottom part of masseter, right? So just right along your jawline, press and friction, the same technique. If you can go just one direction with pressure rather than sawing back and forth, that's the best technique to help the muscle relax. That would be kind of completing both ends of the attachment of masseter. Okay, we're putting on a glove for our final treatment. Now this, you obviously, if you don't mind putting your own finger in your mouth, it does not matter. But if you do, grab a glove and you're pinching your cheek. That's basically all it is. That is where the masseter is. Most of your cheek is the masseter. You're giving a good pincer compression with your first finger and your thumb. And once you find a good spot, you can just hold on it, and you might even want to do that friction again, where you're going to rub your fingers together like you're rolling a pencil between your fingers, something like that. Finding all the trigger points, releasing the muscles of mastication.
Thank you for watching. This is Neutral Movement. You can find us at Body Center St. Pete. We hope you keep it neutral.